Okay. Well, welcome. My name is Amy Johnson, and I'm the Policy Coordinator for the Wisconsin Comprehensive Cancer Control Program. Also on the call are Sarah Kirch, our Program Director for the Wisconsin Comprehensive Cancer Control Program and moderator for the webinar, and Alex Peters, an Outreach Specialist with the Wisconsin Comprehensive Cancer Control Program. Our goal with these calls is to share interesting, relevant information with you that you can hopefully take back to your own work, and more importantly, that we have time on our call for each of you to have discussion time and conversation with the presenters, the Wisconsin Comprehensive Cancer Control Program team, and our fellow council members. The format will be the same for all of the calls, but the topics will change, and we'll discuss that at the end of the call. We use half of this call to share information and the second half for dialogue. Please come prepared with questions, comments, stories to share from your own work. We can accomplish so much more working together, which is the ultimate goal of the Wisconsin Cancer Council. Again, feel free to use the chat box for questions. And so without further ado, I'll turn it over to Darcy Warren and Sandy Bernier.
Well, good morning, everyone. Thank you for participating in this webinar that the Wisconsin Cancer Council is providing to all of you today. My name is Sandy Bernier, and I am the Tobacco Prevention and Control Program Coordinator for 5 counties for tobacco-free living. So I oversee Green Lake, Waushara, Marquette, Washington, and Fond du Lac County, and work with that multi-jurisdictional coalition.
And good morning, everyone. Again, thank you for participating this morning, and thank you to the Cancer Council for inviting us to present on tobacco prevention and control. This is Darcy Warren speaking. So I coordinate the statewide Tobacco Prevention Coalition, Partnership for Tobacco-Free Wisconsin, out of American Lung Association. And I also have another half of my job, which is providing training and technical assistance to local partners like Sandy across the state and local health departments who are working on coalition building towards policy change.
And also, I'm very proud to be a member, this is Sandy Bernier again, of the Wisconsin Cancer Council Steering Committee. So today, I'm just going to give you a little bit of overview of what to expect. You'll have the opportunity, hopefully, to better understand the current status of tobacco and e-cigarette use in Wisconsin, and learn about the tobacco prevention and control programming impacting tobacco use, and kind of hear about the movement action plan, including policy priorities and legislative updates. And we will reserve questions until the end. Darcy?
Thanks, Sandy. So I'm just going to get started by framing some of the problems related to tobacco prevention and control that still exist in Wisconsin. Currently, our funding for the Tobacco Prevention and Control Program is $5.3 million, and that's unfortunately less than 1/10 of the $57.5 million recommended for Wisconsin by the Centers for Disease Control. As you may know, in Wisconsin, no cigarette tax revenue is directed to fund this programming, and no master settlement funding is available in our state either. Recently, Governor Evers included a $3.3 million increase for tobacco control in his proposed budget, and this was dependent on the Medicaid expansion, and it would have been directed to new cessation dollars made available by taking that expansion. And the Department of Health Services was planning to dedicate most of that to the quit line and some to adverse childhood experience field work. But the budget that passed did not include an increase for the program. Instead, flat funding for tobacco prevention and control program will exist over the next biennium. So it's going to remain funded at less than 1/10 of what the CDC recommends. And, you know, we know that tobacco is still a problem in Wisconsin. So next slide, please. Even as the adult smoking rate declines, severe tobacco-related disparities exist in our state. Native Americans smoke at more than double the average rate, and the smoking rate of African Americans is almost as high. This graph shows Badger Care recipients and lower income Wisconsinites smoke at a much higher rate than average, and more than a quarter of LGB folks smoke. 29% of those living with depression smoke. So public health professionals across the state would love to work more with mental health clinicians, AODA facilities, for example, but funding Wisconsin's Tobacco Prevention and Control Program at less than a tenth of what the CDC recommends just can't provide everything that's necessary to address these problems. Next slide. So smoking prevalence is actually at an all-time low of 16% in Wisconsin. It decreased another percentage point this year. Despite the disparities I just went over, this is a huge success. And it's due in part to all the good work done across the state with that $5.3 million investment in this programming. We in Tobacco Prevention and Control are celebrating that victory. The program actually funds 20 coalitions and networks throughout the state, and they leverage partnerships with local public health departments and schools and youth prevention programming and others to lead to successes like the decrease in the smoking rate. They also fund a Wisconsin Quit Line and outreach specialists at UW's Center for Tobacco Research and Intervention who partner with healthcare systems for Quit Line referral. And they fund quit coaches who specialize in helping pregnant women and their families quit smoking. So we're proud of these partnerships, as well as the support for mental health and substance use disorder practitioners to incorporate tobacco cessation into the care they provide, and to help people who utilize Medicaid's extensive cessation benefits. We're also proud of the great work with businesses to help people quit and to keep kids from starting tobacco products. Community education provided across the state by coalitions like Sandy's, as well as First Breath counselors who specialize in helping pregnant women, and the Quit Line has helped hundreds of thousands since 2001. Dollars spent on prevention pay dividends. I'm going to pass it back to Sandy now to explain more about the activities the coalitions and networks do.
So what you can see on your screen there is actually the map of the local coalitions. So local implementation of statewide goals are carried out by these multi-jurisdictional coalitions, such as myself with 5 counties, and disparity networks. And as you can see, there's some gray areas on the map, and those are the areas that we really don't have a coalition at this time. And historically, at one time, we had about 42 coalitions. So as you can see, the work that we've done is great, good, and important, but we do have some gaps in where we actually don't have any coalitions at all. So next slide. And this is a map of the disparity networks, which are the Wisconsin African American Tobacco Prevention Network, the Wisconsin Hispanic Latino Tobacco Prevention Network, Wisconsin Asian American Tobacco Prevention Network, the Native American Tobacco Prevention Network, and Wisconsin Tobacco Prevention and Poverty Network. So if you wanted to learn more about the local coalitions and the network and more about tobacco prevention, you can visit tobaccowiz.org, which you can see on your screen, and kind of look at what's going on in the counties that you might be in and across the state. Next slide. And this is our Wisconsin WINS program. So it's actually a federal mandate that each state has a tobacco compliance program. And we have to keep our rate of sales in Wisconsin below 20% sales to minors, or the state could actually use $10 million in funding that are for federal block grants that really don't have a lot to do with tobacco prevention. So one of the things we do with Wisconsin WINS, we want retailers to be successful in denying sales to minors. So we offer free retailer training, and we offer a lot of resources, like we send out each year when the tobacco retail license are renewed in July. We send out information like, this is what today's tobacco products look like, because you always have new employees, And there's training that's a mandate, and we provide that training online, the state does, and it's free, and it meets the requirement of the state statute. But we also want them to know how to be successful in identifying a minor's ID, which is very important and very easy. Actually, if you look at a minor's ID, it'll tell you the day, month, and year right underneath the picture when they'll be 18 and when they'll be 21. And in the state of Wisconsin, you have to be 18 to purchase any type of tobacco or liquid nicotine. But also, if you're interested, you can go to this website and you can look by county what the rate of sales have been. And of course, our goal is always zero sales, and we try to support our retailers in being successful in doing that. So next slide, please. So this is our FACT group, which is, there's about 300 Wisconsin teens that started this group in 2001, and I was actually able to be part of that in the very beginning. And now there are nearly 3,000 youth members across the state. And FACT teaches leadership skills and requires kids to take part in actions drawing attention to how tobacco and e-cigarette companies target kids. It's basically a peer-to-peer youth prevention intervention program. So next slide. And now we're going to watch a little video from one of our youth members so we can give you a good idea of what that's all about.
Oh my gosh, my mom is my everything. She's the most amazing woman I've ever met. I can talk to her about anything, and we do everything together.
Hi Mom, I'm home.
I wouldn't have it any other way. I love every second of being with her.
Hey, how's your day?
Good. How was yours?
That was pretty good.
Allie was part of the FACT program, I believe, since 4th grade.
That was like one of the best decisions I've ever made in my life, to be honest, because I've had so many opportunities from it, and without it, I wouldn't be the person I am today. But I don't think that I really had a connection to it, like heart to heart. It was just kind of a fun activity that we did during recess. But then when I found out that my mom had lung cancer, I think that's what really propelled my work in it, and it really made me have a reason for doing it. I was anticipating it, and I didn't know what was going to happen. She was gone for quite a while, so that made me a little nervous, and I kind of had this hunch feeling that it wasn't going to be great. And I remember them walking through the door, and she had tears in her eyes, and I knew that it wasn't going to be an easy road. But yeah, it wasn't easy, and we cried for a long time. She hugged me. That was the biggest hug ever. But I knew she was going to be okay.
I don't even know. It's just devastation. Like, wow, I'm 47. Can this really be happening to me? I have so much more to live for. It's hard.
My first thoughts was I didn't want to live life without her.
Fear of the unknown, you know, what's ahead. It's hard.
Yeah, and your time to plan goes so slow. Just be there for them, whatever they need. If they just need to talk about it, if you need to go to their appointment. I had some of the best times with my mom when we were at her appointments, just like playing cards or eating. Like, it doesn't seem like a chore. It just seems like helping her out and being her daughter. That's what it's all about.
You really learn a lot about yourself through this. You learn what's really important in life. Not to sweat the small things.
And it's been the ability to go through life knowing that you're going to get knocked down, knowing that you're going to have hard days, and that just comes with life. Like, nobody's life is perfect. Nobody's going to go through life with everything handed to them. So it makes you a stronger person if you go into it with a mindset that, you know, God gave you the biggest battles to His hardest warriors.
I've learned a lot about Allie. She's a strong girl and a go-getter. She's going to make a difference in this world.
My most memorable moment was for sure the Joint Finance Committee when I was a little freshman and I went up in front of 12 state chairmen and I talked to them about my story, and I was the only youth to participate. And the chairman, after I was done, he said, "Nice job." that was kind of the climax of my FACT career because it was the first time that I saw my voice go into motion, and ever since then it's been so much more.
My last treatment is a rather new one. I guess it's only been around for about 5 years, and I feel like it saved my life. April 11th, the day of my diagnosis and the day they told me I was in remission as well.
It's such a special day, and I think we'll probably make it special for the rest of our lives just because it's our whole journey right there, so yeah.
I guess my biggest advice to anyone that has a cancer diagnosis is really to try not to look ahead. Just try to take it day by day, moment by moment.
It's so scary.
Okay, I mean, as you can see, these are some amazing young people who are really passionate about this peer-to-peer message. So there's another youth that we wanted to highlight, so next slide. And I'll just let you read that slide, but Jackie really was concerned about the juuling in schools. And I can tell you from the number of presentations that I've done in schools, and of course we focus on, you know, the athletic directors and the teachers, and we want all the adults in the room, but we've had kids come up to us and say, you know, my friend has started using one of these devices, whether it's Juul or what kind of e-cigarette it is, and I'm really concerned and I'm not sure what to do. So having these young people engaged in this issue, because somewhat Darcy will talk more about the industry, but you know, we got a whole generation of kids to reject conventional cigarettes, and that was a lot of those public health best practices, and now we have a new challenge, and thank goodness we have these youth leaders who are willing to step up and be a voice for that. So next slide. So I want to talk a little bit about the First Breath program and pregnant women. So pregnant women remain a priority population to help quit smoking. While smoking continues to decrease among pregnant women in Wisconsin, the smoking rate remains higher than the national average. The Wisconsin Tobacco Prevention and Control Program funds counselors through the First Breath program of Wisconsin Women's Health Foundation to kind of target this population. The program serves 71 Wisconsin counties, or 71 of the Wisconsin 72 counties, and help pregnant women, new moms, and their families quit smoking and maintain smoke-free homes. Nearly 1/3 of the participants quit smoking and stay quit postpartum. So that's really a good, important portion of the program that we have with the Tobacco Prevention and Control Program. So next slide. So this is our Wisconsin Tobacco Prevention and Control Quit line. It's, you know, the Tobacco Prevention and Control Program funds the University of Wisconsin Center for Cessation, and this includes the Wisconsin Tobacco Quit line and outreach to healthcare systems, and they refer patients to the Quit line. I can also tell you for our Fond du Lac County Health Department, which is where I'm housed, we also worked with the Wisconsin Quit line to implement a Facts to Quit program, and we also had our Agnesian Cancer Center also implement a Facts to Quit program. And actually anybody can call the Wisconsin Quit line, and you'll speak with a counselor. They'll walk you through, you know, when and if you're ready to quit, what would work, what wouldn't work, and of course the 7 approved FDA medications. So next slide. So let's talk about a little bit about 5 counties for tobacco-free living and what coalitions really do to help support the good, important work we're doing to decrease the burden of tobacco in Wisconsin. So our partnership really involves this multi-jurisdictional coalition, which again I said serves Green Lake, Waushara, Marquette, and Washington counties, and of course Fond du Lac. And some of those counties have higher rates of use, so we try to tailor things to work with them, whether it's, more smokeless tobacco use but we're always seeing an uptick in the e-cigarette issues. But our partnerships, we want them to be wide and varied, so we have a reflection of the communities that we serve. And we have memberships from law enforcement, school health systems, nonprofit, community service agencies, alcohol and other drug abuse counselors, drug-free communities, and we work at the local level to help decrease this burden of tobacco. And our primary focus, of course, is preventing tobacco use initiation by adults and youth. And we're working with schools right now to update their school policies to make sure they have best practice language about these new products and the new concerns, and provide a lot of educational resources to them. We also do a lot of community education with our local and state leaders and talk about, what the snapshot is for the counties that we serve. We also work on eliminating the exposure to secondhand smoke in multi-unit housing, and I don't know if you all know, but in 2018, HUD came down with a mandate that all public housing had to be smoke-free, so no one could smoke in their actual apartment unit. So we did a lot of work with them and talked about the quick resources that we had and how to kind of roll that out in the city of Fond du Lac. Our public housing actually went smoke-free in 2016. And we promote the use of evidence-based best practices for tobacco treatment and dependence, and we'll talk a little bit more about that later. And we're working really hard to identify and eliminate tobacco-related disparities with the various community organizations. For instance, we recently just developed a relationship with our food pantry so we could get information out when people came in to get some of their food and other things, our LGBTQ. So there's a lot of groups that we're trying to collaborate with and have their voice at the table. So next slide, please. And as you know, tobacco prevention and control is a really important component of the cancer control issues because smoking causes cancer, as we know. 90% of lung cancer deaths, and more people in Wisconsin die from lung cancer than prostate, breast, colorectal cancers. Smoking not only causes lung cancer, but it also increases the risk for many other cancers. And smoking kills more Americans than alcohol, car accidents, HIV, and illegal drugs combined. So cigarettes, cigars, pipes, and smokeless tobacco all cause cancer. So there is no safe way to use tobacco. And although the e-cigarette is always talked about as being likely significantly less harmful for adults, we don't know the long-term effects, and it certainly should not be anything that our minors and our young people should be using. And it's very addictive. E-cigarettes contain various levels of nicotine, and it does affect brain development, and kids' lungs are still developing. So studies have shown that vaping by youth is actually strongly linked to later use of regular cigarettes and other tobacco products. And with that, I'll hand it back over to Darcy.
Thanks, Sandy. So as I mentioned, I work with American Lung Association, and part of my job is coordinating the Partnership for Tobacco-Free Wisconsin, and we're the statewide coalition working to reduce the burden of tobacco in Wisconsin. Despite its overwhelming successes and very effective programming, thank you, Sandy, for detailing all of the important work that you're doing as part of your local coalition coordination. As I mentioned, the Wisconsin Tobacco Prevention and Control Program is currently funded at only $5.3 million, less than a tenth of what the CDC recommends. And no tobacco settlement funding is available to address any tobacco problems, and no cigarette tax revenue is directed to fund this important programming. However, there's no shortage of investment by the tobacco industry, right? They're still targeting children with candy flavors, new products, and cheaper prices, and it leads to lifelong addiction. Next slide, please. E-cigarettes and e-juice are not regulated like most tobacco products. Vape shops don't even need a license to open. And the new excise tax on vaping liquid pales in comparison to the cigarette tax. The state budget that recently passed included a 5-cent excise tax on vaping liquid. The budget proposed by Governor Evers included a 71% manufacturer's price on all e-cigarettes and their components. So that would have been a tax near parity to the $2.52 excise tax per pack of cigarettes. Now, that cigarette tax is actually only middle of the pack compared to other states for cigarette taxing. So that $2.52, although it was leading many states at the time it was passed, 10 years ago was the last time it was increased. Now we're about middle when you compare us to other states. The new vaping liquid tax is problematic because it's weight-based. That's a tobacco industry tactic to keep products affordable for teens. The devices still have no excise tax at all. It's just the vaping liquid. With more and more concentrated fluid possible with advancing technology, this new 5-cent tax barely registers compared to the cigarette tax. Coalition partners asked the governor to veto that part of the budget, but his office declined to do so. This slide shows the most popular e-cigarette brand called Juul. It's so popular among youth right now that many kids actually refer to juuling. So instead of saying e-cigarette use or vaping, they're saying juuling. Each container of e-juice for this product contains more nicotine than a pack of cigarettes. It costs less than a pack. It's customizable to design. It comes in cool mint, fruit medley, and mango. And it's become extremely popular in social media sharing apps like Snapchat. So brands like this are part of why the FDA has called this an epidemic among youth. And with the new 5 cents per milliliter tax, one Juul pod would have a 3.5 cents tax on it. So that's compared to a $2.52 per pack of cigarettes, the same amount of nicotine. Okay, next slide.
All right, and I'm going to give you, this is Sandy, I'm going to give you an overview. Now, this is one of the PowerPoint slides I use when I do my community presentations and also when I go into schools, because e-cigarettes come in a variety of shapes and sizes, which is on the left-hand side of the screen, and below that is some of the liquid nicotine. And the top part of the slide, you'll see what looks like a banana split and a chocolate chip cookie dough blunt. And those are actually hollowed out little cigars that you can add loose leaf tobacco and other things in. Usually you can buy those for 99 cents or sometimes 2 for 99 cents. And then you have your little Swisher Sweets that are regulated differently, and they can still make those types of tobacco and candy flavors. And then Darcy talked a little bit about the Juul, which you'll see below, and in the middle is the smokeless tobacco. So all of these products, unlike cigarettes, can be put in, self-serve displays, and they can still be made in these candy flavors. But let's go back to e-cigarettes. E-cigarettes, they come in a variety of sizes and shapes, and these products can be very discreet, like Darcy said. It looks like a flash drive, the Juul, which you see on the bottom. And one of those pods actually contain the same amount of nicotine as an entire pack of cigarettes. And it's a salt-based nicotine. It's a special formula. It kind of gives them the ability to not have that harsh hit when they inhale that. And some of these products, the bigger tank systems and some of those other devices can put out huge plumes of aerosol. So, and you can see some of these flavors. We've had like cotton candy. So you can see where kids would be attracted to these. And I know recently, I'm sure all of you heard in the news that there were 8 cases of severe pulmonary disease among adolescents. They were actually admitted to the hospital. And as of August 2nd, Department of Health Services posted that they're aware of 11 confirmed cases and 7 other cases that are under, what they're looking at currently. Now, just think about, there are over 640 different types of devices, and there's over 7,000 different types of flavors for this. So part of the research that they're doing with these cases and clusters they're trying to figure out what type of device did they use and what substance did they use in there. Because even with the Juul pods, once they're emptied, they can actually be refilled. So, you know, they can mix their own, they can buy these things online, they can buy the liquid nicotine online. And, you know, so nicotine is a poison, and even for adults, we're not sure how they're dosing themselves. So what we try to do is get this information out to the community and the parents, and as far and as wide as we can. And part of that is we also have a website called tobaccoischanging.org where we send parents to, because this is a really confusing time for kids to know, you know, this isn't just water vapor. And the other issue, I think it's a really confusing time for parents because, like I said, there's over 640 types of devices. And until we learn more about those cases, you know, certainly we should be encouraging all adults to be looking at if they are using a device and it's in the home as an adult, they need to put it up, keep it up, lock it up. We've even had increased calls to the Poison Center for toddlers because if it smells like cotton candy, it must be cotton candy. So with that, I'll pass it over to Darcy.
Yeah, thanks, Sandy. So you can see with this simple graph from 2014 to 2018, current e-cigarette use increased 272% among middle schoolers in Wisconsin, and 4.1%, or to 4.1%.
Oh my God.
Someone's not on mute, and I just heard them say, oh my God, and this is the exact reaction that I would expect. You know, the high school rate has increased 154% in those 4 years, and now 1 in 5 high schoolers in Wisconsin are using these products. This mirrors national statistics. Kids are vaping nicotine and other substances, and school officials are reporting it as a crisis among all groups of students. You know, athletes, all groups of students are getting into this vaping trend. And you, again, probably have heard about the cluster of hospitalizations in the past couple weeks. This is a real crisis situation. And in addition to the FDA calling youth vaping an epidemic last year, the Wisconsin Department of Health Services released a public health advisory around this issue before the administration changed. So under Walker's administration, they called, you know, they kind of re-upped the fact that this is an epidemic and released a public health advisory that was very unlike that administration to do. So this is a very serious issue. Many people are asking how dangerous the vape clouds produced by these products are to inhale. Everyone has the right to breathe clean indoor air, and that includes air that's free from this secondhand aerosol. E-cigarette aerosol is not harmless. It can contain harmful and potentially harmful constituents and a very high concentration of ultrafine particles. So the particle concentration is even higher than conventional tobacco cigarette smoke because of this new technology. Exposure to fine and ultrafine particles may exacerbate respiratory ailments like asthma. It constricts arteries. This could trigger heart attacks. Short-term exposure causes eye and throat and airway irritation, and long-term inhalation exposure can result in children developing asthma. So this is from the secondhand aerosol from people who are around others who are using these products. Since the statewide smoke-free workplaces law does not include e-cigarettes or vaping, many communities are updating their local policies to keep air inside public places clean. There's also a statewide bill to do the same that's currently being circulated for co-sponsorship. And that co-sponsorship memo is open until August 15th.
And I get to talk about the great collaboration we had locally here, but I also want to mention that the city of Fond du Lac in April of this year prohibited the use of all electronic smoking devices in all work and public places. because, again, we want to maintain that clean, safe air for everyone. So because coalitions really need all the help they can get to educate the community, the kids, the parents, I had the opportunity to develop a relationship with the radiologist oncologist at Agnesian Cancer Center, who was very passionate about educating kids, parents, and the community. So Dr. Philip Taricki presented like at our annual 5-county breakfast, at our candidate forums, and collaborated with me to do community presentations on tobacco and e-cigarettes. Also co-presented at many of the public and private schools and work with public relations to see what you have on the screen. So we actually got a full-page ad in our free paper that really talked about juuling and, you know, these e-cigarette products and the health concerns related to that. And then because of his support as well and his leadership, we also got that same article in this magazine, Inspire. And I'd been asking for like a number of years, like you have a lot of buses out there that talk about, you know, healthy eating and, you know, brushing your teeth and doing all these things, which are all good, important things, but just give me a bus that says quit now and put the quit line on it. And lo and behold, we got a bus and it said be a quitter. And I was very, very excited about that. But they also on their website connected to our Tobacco Free Living FDL.com website. So once those articles went out, we had another connection where when people went to Agnesian, they could find our link and learn more about the work that we're doing and hopefully join our coalition. So next slide. And, you know, when you have a champion at the local level, you really want to highlight this. So at our annual breakfast that we had on World No Tobacco Day, May 31st, Philip Taricki, MD, radiation oncologist with Agnesian Cancer Center, received our exemplary leadership in tobacco prevention and control from our 5 counties for tobacco-free living. And he received the honor because really he's worked so hard and made this commitment to youth tobacco prevention and control issues within the community. And he also even provided presentation at our breakfast that day, unbeknownst that he was going to get this this wonderful and very worthy award. And now he's also doing some other presentations in some of my other counties. So this is what we're looking for, these really great partnerships who can help us get the word out. And certainly Dr. Taricki can speak to what it's like to treat someone with a tobacco-related cancer. So I'll hand it back to Darcy.
Thanks, Sandy. Such important work. So I just want to pause briefly to explain preemption, since it's very relevant and not everyone knows what it means. I could do an entire webinar on preemption and tobacco prevention and control laws in our state, but I'll just touch on it for one slide. So local initiatives that we can work on are limited because of preemption. Preemption occurs when a higher level of government eliminates or limits the authority of a lower level of government to regulate a certain issue. For example, like a federal law or policy can preempt a state or local law, and state laws and policies can preempt local laws, including ordinances and Board of Health rules. In areas where local laws are preempted, the state law invalidates or trumps the local law. So traditionally, the strongest and most innovative tobacco control policies have emerged at the local level, and that's how progress has been made, often after long and hard-fought grassroots community efforts that go on for years before local policies start to change. And then they're ultimately adopted at the state or federal levels. So because local control is so integral to progress in tobacco prevention and control, the tobacco industry and its allies have historically used and continue to use preemptive strategies to limit progress locally. So we really need to remain vigilant in our state to avoid any new preemption that may come up in any of the tobacco prevention and control bills that are currently being considered in our state legislature. The statewide smoke-free workplaces law that passed a decade ago included some new preemption, actually, specifically around local policies that would be stronger than the statewide law in terms of outdoor areas on patios and privately owned businesses. So that was something that was kind of added at the last minute to the statewide smoke-free workplaces law, and it means that a community can't pass a law where businesses can't have smoking on their outdoor patios. So Wisconsin law also expressly preempts local governments from adopting higher taxes on tobacco products than the state, and it preempts any licensing action at the local level as well. I just want to say, reiterate the comment from Sarah that I think someone's phone is not on mute and it's making some background noise into the webinar. So please do remember to mute your voice lines if possible. So case law also preempts other youth access areas. So there's one case actually out of Fond du Lac where they interpreted that youth access licensing and taxation law to be much more broad. And it means that restricting flavorings in tobacco, moving all products behind the counter, or increasing the age to buy tobacco to 21 are all preempted in our state. And I'll talk about each of these in more detail now. So many communities, as I mentioned, have adopted ordinances to incorporate e-cigarettes and vaping into their smoke-free workplaces policies, and that's not preempted in Wisconsin. So any city council or village board can move ahead in this area, and many, many, many are. And there, like I mentioned, there's also a statewide bill that's circulating for co-sponsorship until August 15th around this issue. Another issue is product placement. So 3 out of 4 Wisconsin high schoolers say it's easy to get tobacco products. And this is out of the mouths of babes. It's reported from the Wisconsin Youth Tobacco Survey. So more than 3/4 are saying it's actually easy to get these products. Next slide, yeah. So you can see the sale of e-cigarettes is significantly higher than cigarettes, and smokeless tobacco and little cigars are even higher than e-cigarettes. Note, vape shops do not require tobacco retail licenses or any license at all to open or operate. It's difficult to say how many of those vape shops comply with laws because of the differences in regulation between vape shops and traditional tobacco license retailers. Online sales of e-cigarettes are also very common as well. You can see the products sold the most are little cigars, and this data is from SINAR, and that's a federally run, very scientific survey of tobacco retailers. Wisconsin youth report being able to buy e-cigarettes and little cigars more easily than cigarettes too. So this is really startling. It's from the Wisconsin Youth Tobacco Survey in 2018. Youth say they can buy themselves little cigars at over 40% when they're getting a hold of them. And so 1 out of 4 youth who have access to e-cigarettes are saying that they're buying them themselves. And that's only compared to 18% of young smokers who say they're able to buy them themselves. So this is a significant difference. And these are, the little cigars and the e-cigarettes, these are all flavored products like the cotton candy and the grape and the bubble gum. According to the Wisconsin Retail Assessment Project, 9 out of 10 surveyed stores sold little cigars. So this is a common product that tobacco retailers will carry, these flavored little cigars that are being sold to kids more often than other products. So when a store sells tobacco, it's very common they sell these products that youth have such an easy time buying. And when you see their packaging, it's easy to tell a story about why. They come in really bright colors. They're in packs of 2 or 3. They really look and smell like candy. Little cigars and e-cigarettes and other flavored products are often kept in front of the counter too. So federal law says all cigarettes and all chewing tobacco have to be kept behind the counter or in a locked case, and they need to be clerk-assisted sale. However, these other tobacco products don't need to be, and many tobacco retailers and vape shops keep other products in front of the counter because there's no law saying they can't do that. So our state's compliance check showed on the floor sales were much more common than behind the counter sales, 20% versus 12%. It gets even more sickening when we examine the Wisconsin Retail Assessment Project data. It shows 1 in 4 retailers surveyed placed these kind of products within a foot of candy and chips. And we know from the body of research around tobacco prevention and control that these retailers have long-term contracts with the tobacco industry. So they're not choosing necessarily where to put these products, right, by the candy and the chips, you know, within 12 inches of, within 3 feet of the floor, for example, and right by candy and chips. Sometimes it's part of their contract with the tobacco industry. There's a representative who comes in and fulfills the contract by putting in an installation into the store of their products. To add fuel to the fire, these products are much more affordable for teens than cigarettes. So cigars are taxed by weight, similar to the 5 cent per milliliter tax that passed on e-cigarettes in the most recent budget. The tobacco industry always tries to get their products taxed by weight because then it gives them a lot more control of messing with the formulations and making the product more addictive and less heavy. So cigarettes are taxed by pack. So as I mentioned, concerning preemption, taxing products and licensing retailers is expressly preempted in Wisconsin law. So this means no local action can occur in these areas, but the state could change policy. An increased tax on brown cigarettes was included in Governor Evers' budget proposal. This would have included just the kind of cigarettes that, the brown cigarettes that come in packs of 20 and have a cellulose filter. So the type of little cigars that I'm really talking about are, you know, displayed in front of the counter and often flavored and sold in packs of 2 or 3. And sometimes they can be bought for less than $1. Wouldn't have been included in that proposal, but the final version of the budget that passed did not include any type of tax increase on brown cigarettes or little cigars. So I want to point out a few adult use disparities too, because obviously the problem with tobacco is not solely a youth prevention issue. And when we're looking at adult tobacco users in all demographics, rural Wisconsinites smoke at 20%, versus urban Wisconsinites at 18%, and both of those are higher than the statewide average of 16%. The chewing tobacco rates in rural Wisconsin are double that in urban Wisconsin, and it's a stark reminder of the limited funding to address tobacco prevention and control in our state. Again, these problems just can't be adequately addressed with less than 1/10 of the recommended funding for this important programming. So I'm really impressed by the partnerships that the local tobacco prevention coalition coordinators like Sandy have with health systems to do things like the bus wrap and the newspaper ad that would not be possible without the partnership of those health systems and other organizations. So these dollars are working really, really hard every day, but no one can expect 100% of the work to get done with an investment of less than 1/10 of what's recommended. And Wisconsin's smoking rate continues to decline, but I just wanted to point out again that the gap continues to widen when considering educational attainment. So you might be shocked to learn that the adult smoking rate of Wisconsin adults is less than high school. It's 5 times that of the rate for Wisconsinites who have a college degree or more education. Challenges also persist in reaching the lowest income smokers with cessation programs. So there's a more than 20% difference in the smoking rate between those Wisconsinites surviving on the lowest income and those making $35,000 or more. So We in tobacco control have the benefit of established organizations who work across the country on these issues. And we have a statewide coalition that I coordinate, which is housed within the American Lung Association. And I'm happy to work with any of you and your organizations to solve these problems. We at American Lung Association have a nationwide staff with experts in policy and marketing and PR and cessation. And American Cancer Society and American Heart Association work very closely with us. Obviously, we have a similar interest in tobacco control policies. These three organizations have huge amounts of volunteers across the state, and they employ lobbying staff. And they're very willing to work with policymakers on solutions to problems I've described. And all the organizations listed on this slide have also joined the statewide coalition too. And you can join the statewide coalition too, as an individual or as an organization. And all you do is fill out the Join Us form at tobaccofreewisconsin.org today if you're not already on our list. And I do recommend that you do that to get updates as statewide policies move in our state. So thank you again so much for joining us, and I know that we now have time for questions. Is that right?
That is correct. Thank you so much, Darcy and Sandy. That was a phenomenal presentation and overview of everything tobacco and e-cigarettes in Wisconsin. We're really appreciative. This is Sarah Kirch, again with the Wisconsin Cancer Council and Comp Cancer Program. As Darcy mentioned, there's time for questions, so feel free to unmute your line or ask a question on the chat, and we will have time now. We have one question from Jamie. Do you have resources for the secondhand vape?
So Jamie, do you mean resources in terms of like in regards to what is in it? Yes, we do. So one place that you can, is someone else talking?
No, it was just Sarah. Sorry, Darcy. You could certainly send us information, and we can provide that in our recap follow-up email with the recording if you'd like. But feel free to share that information now. Sorry to interrupt.
Oh, no, that's okay, Sarah. I just wanted to say that if you go on the statewide coalition website, is one place they're hosted, so tobaccofreewisconsin.org, and you go under RY and then clean indoor air. You'll see that there are all of those numbers and citations on that webpage.
Thank you, Darcy, and thank you, Jamie, for that question. Does anyone else have questions for our presenters? We did prepare a few questions to solicit some discussion if no one else has any specific questions. And one was just kind of for the general group or for our presenters about suggestions or lessons learned that any of you have about tobacco and e-cigarette policy. Another is, what are you currently doing, so anyone on the line, to provide education to the public, including parents, teachers, local leaders, students, on the dangers of e-cigarettes? And do you have any helpful resources to share with members currently doing e-cigarette tobacco work, or perhaps you need any resources that you could share with the parents, teachers, local leaders, or students? So we'll put those out there for discussion. I don't know, Sandy, at the local level, you mentioned a little bit about the education and resources that you shared. Do you have any that if anyone were to leave the call or webinar today that they didn't know about, any resources that you'd want them to leave home with or leave the webinar with?
Sure. I think, the program provided a one-pager on Juul specifically, and we do have, the ability to do some PowerPoints and share some of those things. In terms of, schools and other resources, I know American Lung Association is putting together an educational curriculum that schools can use, and it's not available right now, but it's one of the things the coalition coordinators asked for. So I think there's a lot of resources in terms of education on, e-cigarette, what all the ingredients are, and what the types of the brands are, because honestly, working with schools, they have questions every day about, is this a vaping device? And then we do a little bit of research, because even for those of us working in tobacco prevention control, and I've been doing this for over 20 years, to keep up with some of the devices and the new ways of access can even be, kind of a struggle for us. But we do have some of those resources that would really probably be helpful for anyone who wants to, update and share information about e-cigarettes. And I would also say, like Darcy talked about, some of these candy-flavored tobacco. I mean, the first time I saw one of those double chocolate chip cookie dough blunts, I thought somebody left me a fruit roll-up. So, and they do smell a lot like candy. So I think we do have a lot of resources, and I can share some of those that you can share out as well.
Thank you, Sandy. One question from Denise, thank you, was whether or not this webinar will be recorded and available to listen to later, and the answer is yes. We will be sure to send this out to everyone who both participated and to the membership at large, as well as putting these resources and the recorded webinar on our website. So be on the lookout for that, and if you don't receive it within the next week or two, please just reach out and we'll make sure it gets to you. Sometimes our emails can reach spam filters. If no one else has a question, I actually have a question for Sandy, and not to put you on the spot, but given Fond du Lac's recent work about passing or putting their smoke-free workplace ordinance, including e-cigarettes, did you have any kind of thoughts about, the strengths or perhaps weaknesses about that e-cigarette policy that could perhaps be lessons learned for any other local group looking to do education?
Well, I think Darcy would agree with this. I mean, we have the advocacy partners with American Cancer Action Network, American Lung Association, American Heart Association. So I think for any local community that's even thinking about this, they should certainly reach out. And I would not underestimate the amount of community education. And part of the role that I actually played was just providing that educational information to our city council members. And we also partnered with drug-free communities of Fond du Lac County, because of course they were concerned about the uptick in youth using these devices, also because you can pretty much use any kind of substance beyond nicotine. That was an issue that they spoke to. And then, of course, I had some medical providers that came in and talked about, what they were mostly concerned about. And I think not only the aerosol, because you can, get different substances and order them over the internet, we never know exactly what people are using in these devices, but we always go back to the purpose and intent of the statewide smoke-free air law. And, local communities sometimes went smoke-free before the state, which the city of Fond du Lac was one of those, is your whole purpose and intent is to provide clean, safe air for everyone. And this was not about prohibiting adults from using these devices, but where they use these devices. So our basic message was very simple. Basically, any adult who is using an electronic smoking device, we're just asking them to take the aerosol outside, much like we ask them to take the tobacco smoke outside. So I think those are some of the tips, but I would definitely reach out to, Darcy and other community partners who have expertise in how, that language, best practice language should be developed, because you want a very clear, concise definition of what an electronic smoking device is. And then, they can share information of how a certain community approached this, lessons learned and what they would do differently. So I guess it's really, really critical for anybody who thinks that they want to do this to understand, if you've never done this before, what this process is like. And I wouldn't underestimate, the amount of people who are actually using these devices, which, we always talk about. We're focused more on kids, preventing kids from ever using these. And if you don't have adults using these in public places, it helps to create the social norm that, like, not everyone's doing this. I hope that's helpful.
That's fantastic, Sandy. Thank you so much. We are at the hour at 11 o'clock. I want to be respectful of everyone's time. I want to say thank you again to Sandy and Darcy for all of your work and certainly for putting this wonderful presentation together. So thank you so much. If anyone else has questions or follow-up, Darcy and Sandy's contact information, I'm certain that they would be willing to help answer any of your questions. Feel free to contact us at the Wisconsin Cancer Council Cancer Program. If you have questions, you can reach out to them as well. Just a quick note about upcoming webinars and topics. So September 12th, we will feature a Wisconsin Cancer Policy Update. We have a wonderful newer Wisconsin Cancer Council Policy Coordinator, Amy Johnson, who you heard from earlier. She will be working with our policy committee to create a comprehensive cancer policy update and providing an overview. That'll probably be shortly around the time where we send our next policy quarterly roundup. In October, we will not be having a webinar because we really hope to see all of you in person at the Wisconsin Cancer Summit on October 17th. And more information about that is here on this slide. So October 16th, sorry, it's a little granular or pixelated here, but October 16th in the afternoon, we hope to see you to provide input on the Wisconsin Cancer Plan 2020-2030. As you all know, we are working our hardest to revise that. And then October 17th, we will be having a full-day summit on cancer survivorship, lessons from the front lines, and that'll all be at the Wisconsin Dells. And more information can be made available or is available on our website. Registration just opened this week. So we hope to see you all there. Thank you again for the great presentation, and thank you all for taking the time this morning to learn more about Wisconsin tobacco and e-cigarette issues. So thank you all. Have a wonderful day.